Welcome again to another episode of Biohacking Your Pain. And today I am incredibly excited to talk about a phenomenal product that is Bionicare. And I'm speaking with Dave Schlickstup, who's going to talk to you in depth and detail about this product, specifically dealing with knee pain and osteoarthritis. And the question that I really would pose to individuals is the following: if you're trying to be able to cope with knee pain, what exactly are you doing right now? Are you using medicines? Are you doing injections? Are you doing surgery? Are thinking about doing surgery? And you may have another alternative which may serve you just as well. So I'd like to bring our guest in. This is Dave, who's going to talk to us a little bit about Bionicare, give us some understanding and background about the device. Thank you so much for joining us, Dave.
Thank you, Dr. Landrum. I appreciate the opportunity. The Bionicare is a nice conservative option for patients who are looking for an alternative for knee replacement surgery. Either they don't want to have surgery because they're too young, or they're too old, or they're too unhealthy. And what the Bionicare is FDA indicated for is an adjunctive therapy for osteoarthritis, for reducing or lessening the effects of osteoarthritis, and for improving the overall health of the knee. And I think that's critical. So there's two parts to the system. There's this device, if I can get in front of the screen. This is the Bionicare. This is a battery-operated device. It attaches by an electrode that goes over the kneecap and another electrode that goes up in the thigh. And what this device does is it puts out a duplicate electrical signal that mimics the electrical signal that a healthy knee makes. That's all it does. The history behind it is it was actually developed by two orthopedic surgeons out of Johns Hopkins University who were discussing knee replacements and why is it some people have healthier knees than others, and why is it that people who are typically runners, their knees are actually healthier than people who are couch potatoes. So this was back in the mid 80s when bone growth stimulation was beginning to come out. And so they surmised, since there really isn't a blood supply that goes through the joint, they surmised that there was an electrical impulse that the knee makes when you load it and unload it as you're going through a walking pattern. So they were wondering if they could isolate that electrical signal, which they were able to do. And then literally it took them 12 years to develop a device that would mimic that electrical signal and then keep its integrity as you passed it through the skin and the tissue on it. So once they developed it.
Hey, Dave, that's some serious dedication for 12 years of just continue to plug away until they were finally able to really pull this device. That's someone who knew that this is what they really wanted to do in order to help people.
Well, you're talking 300 units. 300 specific units they developed before they came up with a unit that actually would hold the integrity of the stimulation going through there. So yes, it was. But the key thing about it is once they developed the unit, unlike a lot of other companies that I've been familiar with, what they did then was they started to do studies, clinical studies, not studies sponsored by the company, but good double-blind random studies on whether or not the unit was going to be effective. So they would do short-term ones, try it for 30 days. Does your knee feel better? They did a little bit longer. And then there are a couple of key studies that they've done. One was that if you use the unit for a total of 2,200 hours, you're at the same equivalent spot as a patient is who's a year post-op from having a total knee done. So basically 2,200 hours will equal a total knee. The other study that was done was a study that was done with people who had to be either grade 3 or grade 4 on the arthritis scale. And grade 4 is essentially bone on bone. So what they found was that 62% of the people who were bone on bone, they were able to defer having knee replacement surgery for over 4 years. And the interesting thing about that is that study finished in 2006, and a lot of those people have continued not to require knee replacement surgery. So if you're familiar with a TINS unit is essentially an alternating current designed for helping people who have pain. And what it does is you feel that stimulation, because what it's attempting to do is to mask the pain so that you don't feel it. This is different than a TINS unit. It's like a TINS unit and it's got batteries, cables, electrodes to use with it. But this particular product is more along the lines in the same family of a bone stimulator, in that all it's designed to do is to stimulate the knee joint. And as such, it works subsensory, so you're not going to feel it.
So the whole time it's subsensory, you don't feel anything, but it's in the background, it's improving pain.
It's stimulating the knee. Yeah, that's exactly what it does. So what we have lost my train of thought now.
Can I jump in and ask a question while you're kind of gathering those things?
Yeah,
so
go ahead, please.
This is what I say is, so you just told us how it's different than a TINS unit, which kind of masks the pain with sort of that sensation that you can feel. But you mentioned it's kind of similar to a bone stimulator. How is a bone stimulator different? And what exactly is a bone stimulator for our viewers who aren't necessarily familiar and haven't had the misfortune of having to have surgery?
That's a good question. So bone stimulator is typically used for people who have non-union fractures in which the fracture just will not heal over time. And so that's a device that goes literally over the fracture line, and it stimulates the fracture. And what it has been shown, it too is subsensory. You used to wear them overnight. Now I think you're only wear them for a couple of hours to get the stimulation out of it. But what they have found is that the gentle stimulation over time will actually stimulate the bone to heal itself. So that's how it's different from the Bionicare. One of the other studies, though, that was done with it was what happens if you pair the Bionicare with what's referred to as an unloader brace. And I've got an example of one here. Not sure how well you're going to be able to see this. This is a right knee unloader brace. What it's designed to do is it goes up against the outside part of the leg, and it has a hinge here that allows you to gently push the knee in or gently pull the knee out, so you're able to unload that area where they're bone on bone, where they're grinding.
Tell you what, let's show another kind of pictorial representation that you submitted. So how about something like this, where exactly you could be able to kind of see that area that shows up with that context of being able to see that brace that's in place.
So what the brace is designed to do is it offloads the knee, and it'll actually do a couple of different things. It will give immediate pain relief, but it also makes the Bionicare work about 35%, 40% more efficiently. So it works faster. You don't have to use it as long as you would if you were just using it by itself.
So quick question about that. Mm-hmm. So how, because it's subthreshold and people can't perceive the stimulation, which is probably what most people don't want to perceive a stimulation, how will they know when it's working? How long does it take before you start seeing effects?
Well, the research says 6 weeks before people start to feel anything. I've had people that will call me after a week of using it and tell me that their knee is feeling better than it has in years. There isn't really any studies that will support that, but I tell people 6 weeks is how, and the way they'll determine it is whether or not is their pain increasing or is their pain decreasing. Are they able to walk more normally than they did before they started using the device? How are they sleeping at night? Those kinds of things.
So I got to
So
tell you, as a pain doc, when I heard about this, I didn't jump on it immediately because we had all these different things that we are trying to get back and forth. But the more I've heard about this, the more this product just seems like it's really incredible. Like, why don't more people know about this in terms of like a potential treatment option that it sounds like there's not a lot of downside to it? Am I mistaken?
no, there isn't any downside to it. I think the issue behind it is it almost sounds too good to be true. And I'll be honest,
Right.
when
Yeah.
I first started looking into it, I mean, I was impressed because it had a good backstory behind it. There was good research that was behind it, but I was still a little concerned when I got my first referral, and what I got and what we typically get when we start working with physicians is we get their train wrecks. We get their patients that they've tried everything else on, and they really don't have anything else to to use with the patient. They'll refer them to us. So my very first patient was a 95-year-old lady who lived here in central Illinois, and she lived by herself. She drove. She was healthy as a horse. She just had two crummy knees, and nobody would do surgery on her. So this was in December of the year. We actually put her into two systems. And what she said to me was, I'm going to keep the knee bracing for when I have to go outside, but I'm going to concentrate on using the Bionicares. And so she was using the Bionicare about 18 hours a day. And within about 6 weeks, she was able to start walking without her walker. That's when that opened up my eyes to the potential possibilities here.
That's incredible. That's incredible. I know you've got to have some stories about people where this just kind of, and I'm not trying to really paint this in like, one of those late night TV, like, oh, do this and then you're going to do this. But I mean, but you got to have incredible stories because people that have knee pain, it affects their entire life, right? It takes them from being able to be
Exactly.
ambulatory, being independent, being able to do the things that they want to be able to do. And then they have to make judgments about what should I do that's most important to me right now, as opposed to what do I want to be able to do. So just to kind of diverge for just a quick second, can you give us some of those stories of people where you had a patient that just really touched your heart and touched your head and you're just like, man, I never would have thought that this would have happened. And wow, I'm so happy that I'm representing this product because of how much of an impact I made in somebody's life.
Well, the one guy that comes to mind is we had a VA referral here in central Illinois, and the gentleman he had done two tours of duty in Vietnam as a door gunner, and he suffered a lot from. He was a successful businessman, but he suffered a lot with PTSD. And what he would do when it would get bad is he would go to the golf course to the driving range, and he would just pound golf balls for hours. And his knees got so bad that he was on crutches and told he was going to need a knee replacement surgery. And he happened to go to a physician who does referrals with us, and we put him into a system in November of that year. And the following May, he was out playing golf. It was without pain, without crutches. I mean, it was really amazing to watch. Doesn't help your golf game though, so I can't promise you that.
So, just for those of you who are joining us last minute here, this product that we're talking about is something that's called Bionicare. It is a product that actually is incredibly helpful for chronic knee pain and does a number of things that we're talking about that is sub threshold. So, you don't perceive the actual stimulation, but can be able to increase functionality and be able to kind of decrease pain at the same time. So, Dave, I have a question for you that I'm curious about because you mentioned that aspect of the individual that you just talked about. You guys do some really interesting things for veterans, do you not? Can you tell us a little bit about how this product helps those who actually help us in our most dire time to make sure that we can be able to live the privileged lives that we do?
Uh, yeah, it's a real point of pride, and it's a great pleasure of mine to be able to work with them. The it's astounding the number of veterans who have knee pain, especially guys that do paratrooping or that jump out of airplanes, guys who hump through the woods carrying their rucksacks and stuff. It's astounding. And those, a lot of them do not want to use a lot of pain medication because it just affects the way that they operate day to day. And for a lot of them, they're pretty much at wit's end. The Bionicare gives them the potential. Well, it'll do two things. The brace will actually work immediately to help them walk pain-free, and that's the beauty of the brace. As long as you get it on correctly in the right spot, the brace works. So you can get pain relief immediately, and then you can use the Bionicare at night while you're sleeping to help you and potentially give you the potential for not having to use the brace. So the brace is designed for people who are, when they're active, and then the Bionicare is what they use when they're not active, when they're at night after dinner, when they sleep with it, when they have coffee first thing in the morning before they go about their day. So they work nice in conjunction. There is a way for us to combine the Bionicare inside the brace at the same time. So usually we'll give the patient one of those options to teach them how to use it appropriately.
So to that end, Dave, I know that you guys have done some things for veterans and how you actually supply the brace or how things are addressed in terms of being able to provide them this type of product. Can you talk a little bit about that too?
Sure. So with the VA, what we'll do is the prescribing physician will put the order through the VA system. We're in the federal fee schedule. It goes through for example, here in my particular area, it'll go through the system. I'll get notified that there's a patient who's had the order and has been approved. What I'll do then is I'll call the patient, talk to them, because I want to explain to them exactly what it is. Because it sounds a little weird when you first sit down and talk to them about it. And then what we will do is we'll schedule a time to come out and fit them. Now, before COVID, we would give them the option of fitting in the VA facility or fitting in their home. And because of COVID now, we're doing fittings in all of the veterans' homes. We take all the precautions. We wear all the protective gear as we go in there to work with them. But I'll do the fittings. I'll show them how to work the equipment. And then what we'll do is we'll do follow-up phone calls with them until they're comfortable with the equipment and they know how to use it appropriately. And then we'll do follow-ups I think they're in 90 days and 6 months to them.
Okay. So again, we're talking about Bionicare, a treatment for the knees that's non-invasive in nature. And are there certain patients that are ideal patients for this, like a certain body size? They should have gone through, different types of conservative measures. I think we had one question that came in that was, if people have had surgery in different other parts of their body, like hips or ankles or things like that, obviously that doesn't disqualify them because of them having metal in certain places, I would assume. Can you talk a little bit about who's the ideal patient and who are individuals that might get benefit, but maybe not quite as much?
Well, the ideal patient is somebody who literally has their original knee joint. My feeling and my experience has been with it that as long as I have somebody who has their original knee, they are compliant in wearing it, and they don't have a whole lot of comorbidities. We still get results. We don't get as great a results as we do with somebody, but if we have somebody who has diabetes or it seems like cancer or heart disease, they don't see quite the results that we do with somebody who's healthy, but they still see results. Our ideal patient would be a 40-year-old or a 45-year-old person who's healthy, just has bad knees and is really too young. But what we get are the entire gamut of patients. We get the morbidly obese because they don't have any other options. And we get the very old, and we get the very young. So we really run the entire gamut. But the key thing is, as long as I have somebody who's got their original joint, even if because what we'll hear from people routinely is on bone on bone. Well, the X-rays and the MRI may show that, but you've still got something in there that the machine seems to be able to work with. So really, as long as I've got somebody who's compliant, I feel pretty comfortable we'll see results with it. And even without if they don't see complete results, the bracing will help them walk without pain. And the key with that is then you don't have to worry about a patient falling or fracturing a hip or doing anything like that. The brace will allow them to go about their activities, their normal day-to-day stuff.
Hey, Dave, so we got a few questions that are coming in fast and furious, but one of the things I want to do is kind of take a little bit of time to make sure, in case people had to jump off of this video or really kind of had some other things that they weren't able to watch this in its entirety, that they knew where to contact you. So I just want to kind of pop up some information so that people can be able to reach out to you directly, and maybe you can comment if this is incorrect. But this is your phone number, fax number for Bionicare Osteoarthritis System. And as I read it, it's 309-453-1001. Is that correct?
That is correct.
Okay, so we'll pop that up a couple different times for people to be able to kind of get that information, jot it down, where they can be able to reach you, get you directly, and now therefore don't have to jump through multiple different hoops. And that's what we're about, is trying to be able to help people punch pain in the face and get back to being able to lead the lives that they deserve.
And if it's more convenient, they can text me on that at that number too.
All right, Dave, with the high technology, being fancy here. Okay, all right. So one of the questions that came up is, how long does the relief last for? And I think you can be able to kind of help explain some of that, what that means. But I think they're saying, how long will symptoms remain improved after you've gotten some improvement?
Great question. So the one question that no one has asked yet, I don't believe, is what exactly does it do inside the knee? And the answer is we're not real sure. Nobody's ever let us open up their knee after it's been improved. But if you think about it, what the device does is it bathes the knee, it surrounds the knee in this very efficient, very healthy electrical signal. It sort of tricks your body into thinking your knee into thinking it's 10 years old. Back in the time when our bodies were more efficient and everything worked much better. And as we get older, our systems don't work all that great. So that electrical system that takes place in the knee basically degrades over time. So what we tell people is use the device. When your knee's improved to the point that you don't feel like you need it, put it aside in the closet. Once you stop using it, your body goes back to producing the electrical signal of your age. At some point, you're probably going to start having knee pain again, and all we need to do is put you in. The only patients that I've had recycle back into me, and I've carried this product for probably 10 years, is I had two 88-year-old ladies who both used it, had relief for 4 years, and then called me back up almost within a week of each other, saying that their knees were beginning to bother them. And all we did then was we just put them back into the Bionicare for sleeping at night, because their knees hadn't gotten to the point of where they were limping around or worried about falling because of the pain.
Okay. So the other thing that I'd be kind of curious about is, are there any side effects to the electrical stimulation that we know of?
No, there are none. The only thing you can run into is occasionally we run into skin irritation, and typically that's with people who are diabetic. That's not a game stopper, because what we do is switch them over to some sensitive skin electrodes. So there really isn't, you can wear it. And in fact, what I tell people is the, the whole system is designed to how many hours can we get you up to. And so I tell people to think about using it for about 2,000 hours total. There's a timer inside the unit that keeps track of how many hours that you've got, that you've worn the equipment on there. So, but the faster you can get up to the 2,000 hours, the better off we are. So if you're going to have a day, or you're not going to be too terribly active, you're just going to be around the house, or it's the evening time after dinner, you're going to be watching TV or reading or something like that, put the unit on, wear it. You're not going to hurt yourself. It just gets your benefit up that much faster. The only thing we don't want to see you do is we don't want to see you out jogging down the street wearing just a Bionicare, because that's not what it's designed to do.
All right. So to that end, let me ask you a quick question. You have kind of a brand ambassador in essence, who is really an individual who's done some things that are just amazing, and your product has helped them be functional. Can you tell us a little bit about that individual?
Sure. So there's a guy, he's kind of our poster child down, and this is Harold Wilson. Harold retired from his job as in a chemical plant, and he took up long distance running, which is not something that I would do in retirement. Frankly, I'd keep right on working. But he turned out to not only like it, he turned out to be really pretty good at it. And he worked himself up to where he was running in the Boston Marathon. In 2005, he was told that he had to stop running because he had severe osteoarthritis in the knee. He used the Bionicare for a year, and he has continued running every year in the Boston Marathon since that 2005. And he's not required using the equipment again. So he's won his age division. I think last time he won was the year that they had the Boston bombing. He had actually crossed the finish line shortly before that explosion occurred. But I think the last time he ran it, I think he only did third. But he's in his 80s, so
I think that's pretty darn impressive.
It is I couldn't agree more. I could not agree more.
All right. So it sounds like this is a heck of a product. I don't think that there's as many people that know about it. I'm in the pain field. It took me a while until you even approached me about this. And I was like, huh, okay. So if you could have a billboard with anything on it in reference to the professional context of Bionicare, Dave, let's keep it within germane here. What would you have on this billboard so that people would have a better understanding about what this might be able to do and how it might be able to be of value to them?
I think I would be inclined to have exactly what I have behind me in this poster that says "Save Your Knees," because we just the people that come to us that we haven't dealt with their referring physician. Those are people who are looking for an alternative. They're actively looking for an alternative, so they're researching things to try to find out what's out there and what's available. So I think just this poster that says "Save Your Knees" would garner a fair amount of interest and response.
Okay, so let's talk about really the canary in the mine. The thing that I think people are really going to want to kind of know is their ultimate element is, so what's up with the aspect of insurance coverage and monetary cost?
Great question. I knew we were going to get to that. So the brace is typically covered. All the major insurance companies cover it. That's not an issue on it. The Bionicare portion of it used to be covered when I first started carrying it 10 years ago. It was covered completely. And then for people who remember when President Obama was in office and we had the sequestration foolishness going on, Medicare cut funding on a number of different items. And so they cut partial funding on the Bionicare. And then when President Trump came in and presented his first budget, they cut out the rest of the funding on it. So the company sat down and decided, it's not an insignificant amount. It's $995. They'll split up that cost in payments if they have to. But the key thing that I want people to remember is the company is so confident in this product, they actually offer a money-back guarantee. So the way the money-back guarantee works, if you remember, I said there's a timer inside the unit that keeps track of the amount of time that you're wearing it. You have 5 months to get to 750 hours, which is doable if you're using it on a routine basis. If you get to that 750 hours and your knee is not demonstratively better, all I need is a note from the physician that says your knee isn't any better. You got to give me the unit back, and the company will refund your money, which is a pretty powerful statement for how much confidence we have in this product. And I've had patients who have purchased out of pocket. It happens fairly routine, and I can think of 3 patients off the top of my head that we had to refund their money back. One of them was, interestingly enough, her husband was a referral that came through the VA. So I came out and I fitted him with the equipment on it, and she was so interested in it. I think they were going over to Europe to take a hiking vacation. And she was so interested in it, she wanted one for herself. But so what she ended up was paying for it out of pocket. He got better. She didn't. And that happens. It doesn't work on everybody. So we ended up having to pick up the unit and give her money back.
Okay. So 3 returns, give or take, in 10 years.
It's probably closer to a half a dozen, I would say.
Okay.
But there's only 3 that I can remember.
That's pretty darn good, is what I would say.
Well, and the other thing that I would get into is, when you look at where Bionicare fits in that conservative treatment cycle of, before we get the surgery, let's do anti-inflammatories, let's do physical therapy, let's do bracing, let's do injections, let's do the hyaluronic acid, let's do, okay, none of that has worked, let's do the surgery. So at least you work through that system, that the knee replacement, everything else has not worked, knee replacement's the only option. Because frankly, I still get referrals. I probably get 4 or 5 referrals a month from people who've had knee replacement surgery. They still have pain, they still have instability. And at that point, all we can do is put them in a brace to help them walk and to help them offload the knee. So.
Exactly. So in my own experience, knee replacement works for a good number of people. Let me just be clear. I'm not trying to ding knee replacement, so orthopedic surgeons just ease back a little bit. All right. However, I have treated patients that have had knee replacements and haven't gotten a good response. And I think if patients knew that there are options besides just steroid injection and a knee replacement, as a litany of things that you just mentioned, I think that they would really be able to make an informed decision and say, you know what, maybe I might look at something else prior to me jumping to the context of going after an immediate surgery. I might do some of these other things, whether it's cold radiofrequency or viscosupplementation or however else you might want to try and treat it. Because at the end of the day, you still have that option, right? So
absolutely.
one of the things that I had come up, and I think it's from one of our veterans who's still kind of a little bit shocked. And so I will reiterate his question again. He's like, are you sure the VA is covering the cost?
Yeah.
I think he needs to kind of like have that. He's like, are you positive? So with that in, he's like, yeah, I just want him to be aware of what really we got going here.
It's and again, it's not unlike us going into a brand new physician office. We go into a VA clinic. They've never heard of us. They're interested because they're trying to help the patient. And so what we'll get their train wreck. And then when they find out that their train wreck actually, does well with it, and more important, and just as importantly, that we're going to take care of them, because that's a key thing too. We're not just going to drop the equipment off and disappear. We're going to make sure that they're comfortable with how to use it. So the VA has become a big believer in it.
So one of the questions that came up is, this is working so great for the knees. Does it work for any other joint? Have they figured out the electrical current and sensation that fits?
Well, I wish they would. We always get asked about, will it work for the hip? And the challenge with the hip is that it's such a deep joint in the body. It's really hard to get any stimulation actually down into the joint. We have discovered that the Bionicare will work for patients who have rheumatoid arthritis of the hand. What's interesting about it is they will get immediate pain relief. There's a glove that goes over the hand, and the electrodes attached to the glove and transmit the current through the glove. They'll get immediate pain relief. They're not going to get better. So it's one of those things that they use to manage their pain as they're going along. But that's the only other use we've been able to get to that we've been able to use with it.
Okay, so I'm going to do a quick little plug for our channel here. We're going to come back and wrap up a few other additional questions here. One of the things that I want to do before I jump to that plug real quick is to make sure people know where they can be able to reach it. And so again, this is the number 309-453-1001, which can not only accept phone calls, but also text, as Dave just told me. And so we want people to be able to reach out to him directly so that you can have an option of having a discussion about how can you be able to get some improvement. And I want to just take a quick break to talk about what we do here on the aspect of biohacking your pain. So Dave, question for you. If you were reflecting back on this 3 years from now, what would you want to have happened, both personally and professionally, for you to feel like what you've had has had some degree of progress and success?
Well, I'd like to see it used more universally, and specifically with orthopedic doctors. I'd like it to become. I wish that it would be covered by the insurance companies. I don't think that's going to be the case. I get a great deal of satisfaction carrying this product, just because it's worked and it helped people change their lives. And it's not unusual for me to put somebody into a brace and to have them literally break into tears because for the first time, they're able to function without pain. So I just look forward to the next 3 or 4 years to just being able to carry it and keep doing what I'm doing.
Thank you so much for your time. Are there any questions that I missed asking you that I should have asked you about this product that you think is just that golden nugget that patients and watchers would really want to know?
No, I think you covered everything, and I appreciate the opportunity on there. I mean, what I want people to understand is this is a device that has good research behind it. And in fact, if they would like to go to the Bionicare website, which is just www.bionicare, BIONI, it's right behind me, CARE.com. All of the studies are there. There's videos of people that have used it. There's people describing it, so they can go and research it on it. And just to recognize this is a good conservative option for people to try before they move on to something else more serious. And there's the website.
So again, Dave, thank you so much for joining. I really appreciate you coming through. Hopefully, as we start seeing the uptake of the use of this product, people will start telling their friends and showing how useful this can be and how life-changing it can be as a product.
I appreciate the opportunity, Doctor. Thank you very much.
All right. Take care and have a great day.
All righty. Bye-bye.